What is the difference between EMG and nerve conduction studies for muscular dystrophy? Imagine trying to figure out if a building's electrical system is working properly. You might test the wires and the outlets separately. That's similar to what doctors do with electromyography and nerve conduction studies when diagnosing muscular dystrophy. Both tests look at how nerves and muscles communicate, but they focus on different parts of that process. Electromyography, or EMG, involves inserting a tiny needle electrode into a muscle to record its electrical activity. This test shows how muscles respond when they are at rest and when they contract. In muscular dystrophy, muscles gradually weaken and degenerate, which changes their electrical signals. EMG can detect these abnormal patterns, helping doctors see if the muscle fibers are damaged or not functioning properly. It also helps distinguish true muscle weakness from other causes like pain or psychological factors. The test usually takes about 30 to 60 minutes and is generally well tolerated, though some people might feel slight discomfort from the needle insertion. Nerve conduction studies, or NCS, are a bit different. They measure how fast and how well electrical signals travel along the nerves before reaching the muscles. During this test, small electrodes are placed on the skin over nerves, and a mild electrical pulse is delivered. The test records how quickly the nerve conducts the signal and how strong it is. NCS helps identify nerve damage or dysfunction, which can cause symptoms like weakness or numbness. However, it does not directly measure muscle activity. This test is quick, usually lasting about 15 to 30 minutes, and is painless, with only a mild tingling sensation from the electrical pulses. When it comes to muscular dystrophy, EMG is especially useful because it can reveal characteristic electrical changes in the muscles themselves. Muscular dystrophy primarily involves muscle degeneration, so abnormal EMG patterns support this diagnosis. NCS is often performed alongside EMG to rule out nerve problems that might cause similar symptoms. For example, if nerves are damaged, that could mimic muscle weakness, but NCS can help confirm whether nerves are involved or not. The main difference is that EMG looks directly at muscle electrical activity and health, which is central to muscular dystrophy. NCS examines nerve function, helping to exclude nerve disorders or identify nerve issues that might coexist. Both tests together give a complete picture of neuromuscular health, guiding accurate diagnosis and treatment planning. Always remember, these tests are tools to help doctors understand your condition better. If you or someone you know is undergoing these procedures, it's best to discuss any concerns with a healthcare professional. They can interpret the results in the context of your overall health and symptoms, ensuring you get the most accurate diagnosis and appropriate care.